Hello, my name is Dragana Skokovic-Sunjic, and I'm the author of this poster titled Use and Acceptance of the Clinical Guide to Probiotic Products available in Canada and in the US, translating scientific evidence to clinical practice since 2008. This is the poster presentation demonstrating the translation and clinical application of probiotic research into practice. Some of the background was that there is a widespread use of probiotics. They are very current and widely accepted. However, it is relatively difficult for patients and even healthcare providers to tailor the recommendation for their patients. Often, doctors don't have time to sift through all the newly emerging research and form their own opinions about what probiotic their patient should take. And oftentimes, it is so much information to wade through for both the doctor and the patient that poor recommendations are made, if any. So in order to remedy that, this clinical reference tool was independently designed to translate the scientific evidence available up to date for the commercially available products, because the research isn't really relevant if the consumer or patient can't find it and use it. So to translate this into practical and clinically relevant information for providers to communicate with their patients and make informed recommendations, this project aims to outline the need for evidence-based probiotic recommendation with strain specificity, describe the practical applications of probiotics in adult and pediatric health issues, and bring awareness to the clinical guide to probiotic products in North America as a whole. And here for illustration, we have an example of what this guide looks like. Still, how we went about doing this, we have an annual review process in place of the most up-to-date scientific and clinical references available for available products, for specific strains or a combination of strains used to treat symptoms or particular diseases. And the review of this published evidence is based on defined inclusion criteria, and the weight of this evidence is evaluated by a team of expert reviewers from across primary care and gastroenterology throughout North America. The inclusion criteria are listed, so based on this, if the product does not meet all 4 inclusion criteria, we really cannot consider it to be included in this reference tool because there is a strict criteria for inclusion. Moving on, we have a specific excerpt from the adult and pediatric health table. So what you see in the first column, we include the brand name of the probiotic product commercially available and the probiotic strains present within that product. These probiotic strains translate directly to the clinical evidence that we have reviewed, and we are not supposed to extrapolate based on the individual strain performance in studies. So if a combination of strains for a specific brand has not been demonstrated to have clinical evidence, when combined together, we cannot consider that product in the guide. Included here are dosage forms, whether they are drops, capsules, sachets, etc., and the number of colony-forming units per dose. To help the doctors, dietitians, pharmacists make informed decisions, included are the number of doses per day as recommended based on the studies cited. In each cell of the table's right-hand side, you see Roman numerals under the various disease columns. These Roman numerals describe the level of evidence or level of recommendation for a specific product in relation to that particular health-related problem. Below the Roman numerals included are references linking to the studies we used to assign the indication and level of recommendation for a specific product. In conclusion, when healthcare providers consider recommending probiotics, they need to specify the particular strain where possible. To make that easier, sometimes brand name required for patients to treat specific symptoms. Over the course of 13 years since we started doing this, there was a lack of clinical guidelines to recommend probiotics for patients, and that is why this project started in the first place. We aim to close the gap between emerging research and clinical practice, empower clinicians with practical guidelines, and help patients using probiotics. Due to the frequent changes in the commercial availability of probiotic strains and the newly published evidence and growing research, this process is part of an annual review and has been since 2008. Future plans for this project are to continue this initiative, perform annual updates as previously described, and explore avenues of making these results more easily accessible to clinical end users through the format of mobile apps, interactive websites, and readily available print formats. I want to invite you to explore online options. All links to Canadian and US versions and mobile apps are listed at the bottom of the poster. All information presented across the various platforms is consistent. There are no differences in content between the website, mobile app, and print version, part of which you can see here. I hope you find this information valuable for your future practice. Thank you for your interest in this important topic.